And then kind of support her head too as she comes back, just so that it doesn't flop. Okay. And we'll stop before it gets to where it's going to hit her, and then we can go ahead and pull out. I think the most important thing for using a lift is to be able to follow your training, to look at your training and to be able to follow all of those steps sequentially and not get in a hurry, because I think often people get in a hurry when they're using a device or even doing a regular transfer. Sometimes we have a tendency to get in a hurry. So slowing down, using the appropriate steps, and making sure that you planned ahead and moved things out of the way so that you can move from point A to point B without having to stop and start again.
Bedpans are made of plastic and come in two styles. The contour bedpan is larger and shaped for comfort and stability. The fracture pan has a low wedge shape that makes it easier to position. It requires less movement by the person in bed. Using a bedpan is often a source of shame or embarrassment. Remember that preserving the person's dignity is an important part of caregiving. Respond quickly when he or she makes a request for the bedpan. Begin by washing your hands. Always wear gloves when you are helping someone use a bedpan. Talcum powder on the surface of the bedpan helps reduce friction and makes it easier to slide under the body. When using a contour bedpan, the buttocks should rest on the rounded shelf of the bedpan. The narrow end of the bedpan should point toward the feet. The fracture pan is placed with the flat end toward the head and the higher rim toward the feet. The bed should be in a flat position. Place a waterproof disposable pad under the person's buttocks to protect the linens from spills or soiling. If he can assist you, ask him to bend his knees and press the bottom of his feet against the bed. As he raises his hips, slide your hand under the lower part of the back and gently lift the hips at the same time. Then slide the bedpan under the hips. If the person is unable to raise the hips, turn him onto his side with his back facing you. Position the bedpan against the buttocks. Turn him onto his back while holding the bedpan in place. Check to be sure the pan is under his buttocks. To keep him warm, be sure he is covered with the top sheet or blanket. Elevate the head of the bed approximately 30 degrees to a semi-sitting position. Place toilet paper within reach and a bell or noisemaker so he can alert you when he is finished. Allow enough time for elimination. Allow the person privacy during bedpan use. Always remove the bedpan as soon as the person is finished using it. A bedpan left in place for more than 15 minutes can cause damage to the skin and underlying tissue. To remove the bedpan, follow the same procedure and gently slide the bedpan from underneath him. Hand him a disposable wipe so he can wash the rectal area after a bowel movement. Use a second disposable wipe for washing his hands. You can also use an instant hand sanitizer for cleaning the hands. Then reposition him comfortably in the bed. Put on another pair of gloves to empty the bedpan contents into the toilet. Clean the bedpan using an antibacterial cleaner such as Lysol, warm water, and a toilet brush. Then rinse and dry. Remove and discard the gloves. Always wash your hands after removing gloves. Elasticized stockings are used to improve circulation and prevent swelling and blood clots in the legs. They come in a variety of sizes and lengths. After washing your hands, begin by telling the person what you plan to do. Make sure the legs are clean and dry. Then gather the stocking down to the heel. Pull the stocking over the person's foot and heel. Check that the heel is properly placed in the heel of the stocking. Continue to pull the stocking upward over the leg. When you have finished, the stocking should be smooth with no wrinkles. Use the same procedure for the other leg. Stockings should be removed and put on again every 8 hours. Elasticized stockings should be changed daily after bathing. Check circulation by examining the color and warmth of the feet and toes. Bed linens should be changed weekly or immediately if soiled or damp to reduce the risk of infection. To make the bed with the person in it, lower the knee and head sections until the bed is flat. Wear gloves when changing soiled bed linens. Loosen the sheets and blankets that are on your side of the bed. Remove all the covers except for the sheet or cotton blanket to keep the person warm. Then roll her to the far side of the bed. She should be lying on her side facing away from you. The side rail should be up to prevent her from rolling further. Then fold or roll any bed pad or draw sheet toward her and tuck it against her back. Roll or fold the bottom sheet and tuck it under her back. When using a fitted sheet, place the fitted corner at the top and bottom corners of the bed. Then smooth the sheet at the center and tuck the remaining sheet up against her back. If you need additional pads or draw sheet, follow the same procedure. Tuck the portion of the sheet or pad that will go on the other side of the bed up against her back. Then smooth the sheet on your side and tuck under the mattress. Now roll her gently over to the clean side of the bed. Remove the soiled linens and place them in the laundry bag. Pull the clean sheet from the middle of the bed, pulling it firmly to make a tight, wrinkle-free bed. Pull any additional pads or draw sheet from the center and tuck them in. When changing the top sheet, be sure to leave room so that the feet can move freely. Spread a blanket over the top sheet. You can use a blanket support to keep the weight off the body. The weight of a blanket causes some people pain and discomfort. Then change the pillowcase. Reposition the person comfortably before leaving the room. Physical activity is limited for a person on bed rest. Without exercise, muscles weaken and joints stiffen. Range of motion exercises are designed to move muscles and joints through their complete range of motion, helping to maintain strength and flexibility and increase circulation. Range of motion exercises should be encouraged on a daily basis. With certain conditions such as fractures, blood clots, or arthritis, these exercises may not be advised. Check with your doctor first before performing range of motion exercises. Active range of motion exercises can be done by the person independently. Caregivers should encourage the person to perform the exercises. Learn the exercises yourself so that you can teach him. To exercise the neck, move the head downward as close to the chest as is comfortable. Next, straighten the head. With the head level, slowly turn the head to the left as far as is comfortable, then back to the center. Slowly turn the head to the right, then return to center. Repeat several times. To exercise the shoulders, rotate the shoulders forward in a circular motion, and then rotate them back in a circular motion. Begin with the arms at the side of the body and the palms facing inward. Raise one arm out to the side with the elbow slightly bent. Lift the arm until it is above the head. Then lower the arm to the starting position. Repeat with the other arm. To exercise the elbows, start with the arms at the sides with palms turned upward. Bending at the elbow, raise your left forearm towards the left shoulder and try to touch the shoulder with your fingertips. Straighten the arm. Repeat with the other arm. Exercise the thumb and fingers by holding the fingers and thumb close together and then spreading the fingers and thumb apart. Make the hands into a fist and then release the fist by spreading the thumb and fingers apart. Repeat these exercises several times on both hands. To exercise the hips, start by lying on your back with the body in proper alignment. Keeping the legs straight, raise and lower one leg at a time. Exercise one knee at a time. Bend your knee by sliding your foot up until it is next to your other knee. Keep the sole of the foot flat on the bed. Then straighten the leg back to the starting position. Repeat the exercise several times. To exercise ankles, feet, and toes, first flex the foot by bringing the toes up toward the leg and then down away from the leg. Then rotate each foot in a circle clockwise and then counterclockwise. Caring for someone on bed rest is an intimate and challenging responsibility. It requires physical and emotional strength, as well as important technical skills. Learning these essential bed rest skills will help make the experience more pleasant and rewarding for everyone.